Am I sharing right now?
Yes, you are. We can
Okay.
see it just fine.
Okay, thank you. Thank you. Sorry, I keep using the Zoom to present in Teams, but it's not the same. I have to learn how to use Teams. Okay, thank you so much again. So this one is a little bit different. In the first one was low tech. Of course, we're trying to discourage AI use in writing papers and forums, and seeing that authentic conversation happening. This one happens on a flip hand, so this is more of a medical surgical course, and this course really used um, try to use case-based learning with generative AI and peer facilitator to really foster deeper learning for students. Sorry, I'm gonna cough. Okay. So with respect to the outline, so we're going to talk about why the assessment, rethinking the assessment in this course and why we should rethink assessments. I'm going to briefly just highlight the clinical judgment measurement model for people in the audience that perhaps are not in nursing education. And then we're going to talk about why case-based learning was used as an approach for this course. So with respect to the background for us as nursing educators, and I've heard also from previous speakers, we continue to see a gap between what they're learning in school in theory versus how they're applying it to clinical practice. Especially a lot of new grad nurses, they're becoming very stressed when they enter into the profession because they're not adequately equipped to encounter the complexity of the current practice. And because of that, the licensure exams have made some changes and introduced what we call the clinical judgment measurement model, which is a way of assessing or evaluating their critical thinking skills, and how they can apply their reasoning to a complex clinical situation. And usually the current approaches that we use are usually teacher directed. So for example, in the class I'll be talking about, they do have a lab component to the class where they have low fidelity simulation and a case study, where it's usually teacher directed. We also used flip learning, case studies in class itself, interactive media to, of course, foster learning. However, the fact that the students are not fully engaged in the learning, or it's not student directed, really leaves a gap with respect to getting to that higher order thinking that is necessary to really think about what they're doing or how they're going to perform in clinical practice. So here's what the clinical judgment. So clinical judgment, basically from the literature, is really how do we connect our knowledge to our patient care management. So how do you apply what you're learning, and how are you able to make decisions in in real time in clinical practice, right? So it requires you to have that core competency. So not just memorizing, not just knowing the condition, but the ability to apply it when you have a patient in front of you. And in a condition-based curriculum like ours, so I work in a condition-based curriculum. Basically, what that means is we go through different conditions in our pathophysiology classes. It's not a concept-based curriculum. Sometimes students struggle to link those concepts together and usually just learn them in silos. So this is what the clinical judgment measurement model try to encourage learners to really think deeply and analyze critically. So this is just an example of what it looked like. So similar to our nursing process, which is the way we nurses do things. So assessing the patients, analyzing the cues that we're seeing, prioritizing the hypothesis, like what do we think this patient has? Where do I start from? And generating action. Again, I want to note that this is a cyclical process. So even though this image shows 1, 2, 6, this is something that happens over and over again in nursing education and nursing practice. So my goal overall was to design a student-directed formative assessment that encourages critical thinking, collaboration, and application in my classroom. So sharing a little bit of my learner context. So this learners that have decided to pilot for this project, they're after degree nursing students. Basically what that means is that they've had a previous degree and then they have to complete nursing in 6 consecutive semesters. So 2 years they have to complete their nursing degree. They range in ages, so more matured students. I've had, the odd 50 something as well, so between 20s to their 40s, and they have diverse backgrounds on science, arts, business. They have a lot of backgrounds, and they need to have their knowledge of anatomy and physiology. However, some of them would have completed it years ago, and the ones that completed it recently, they really only completed as, okay, I need to get into nursing school. I just need to do what I need to do for this anatomy and physiology to get into nursing school. Then they forget because they've memorized, right? So this is always a problem because then they come to nursing school and then we're saying we need to build on that foundation, and but then the foundation is not there. So the way they cope is they often default to rote memorization just to get through the semester and get through their nursing school. But what we're seeing is it starts to catch up to them once they get into their clinical placement. They're not able again to transfer the knowledge from the classroom to their clinical setting. I should also note that these learners are quite, to acknowledge the strength of my learners. So they're quite mature, they're very motivated, they have a strong sense of purpose, and they really, really want to succeed. So this was the prime learner group, I would say, to pilot this on because they're very, very motivated. And they also have a lot of life experiences that they can share with their peers together when they're learning. And why choose case-based learning with respect to a formative assessment tool? So like I said earlier, we already have other different activities we did in class. We had a lot of different, but they were often teacher-directed, right? And then there comes problem-based learning. However, it was harder to use problem-based learning for this group because they're new. They're new to nursing. Like they don't know the terminology, and problem-based learning can be quite. It's not very. When it comes to time, it's very time consuming compared to CBL. And case-based learning really allows for us to do the same thing but have structured guided questions for students as they go through an hypothetical or real case scenario. They have that guided questions for them, and that enables them to actually feel supported while at the same time ensuring that independence and them creating new knowledge from what they're getting. It also aligned with my philosophical approach, which I mentioned earlier as well, that I believe that learning happens through interaction and sharing previous life experiences and building on and drawing those experiences into our current learning. So that's why I chose case-based learning. So with respect to getting started with this, so first of all, like someone said before, it's always important to contact your Center of Teaching and Learning when you're looking for other things to do or resources in your course. So I contacted Dr. Salam, who is one of our developers in our CTL with respect to some of these conversations and thoughts in this course. So together we talked about a few things that we can do. So one of the things that came out was peer facilitation. So I invited senior students who had taken the course before. I invited them via email to see if anyone was interested in being peer facilitators for this project. And the goal of the facilitators was to facilitate those small group learning, right? So of course we had a few volunteers, and those volunteers were trained by Dr. Salem with respect to group dynamics, conflict resolution skills, how to really facilitate a small group. So they had to have a training beforehand before starting the course. So this was, prior to starting another 14-week of the course. We also, of course, using the clinical judgment measurement model, use that to create reflective questions that can be used in their small group. And then I'll share what I did also for the AI group. They also had reflective questions, but more importantly, they had less synopsis. So they had to work with their peer facilitator to create more things with respect to the patient scenario, and they had to apply their learning in the semester to be able to help them to generate what they think the patient's vital signs should look like. What do you think the patient's diagnostic test should look like? How should a care plan look like for this patient? So they had to do a little bit more in that situation. So this was what the activities looked like. So the first group had a full scenario. They had guided questions, and then the patient also got worse. So they had complications, and they also had guided questions with respect to those complications. The second group had the patient synopsis and a little bit of questions, but they had to use generative AI to create a full patient profile and a care plan for their patients. And I should mention these two groups had peer facilitators with them. And then the third group, I myself was facilitating this group, and the focus on this group was really on pharmacology. The students concurrently take pharmacology with this course, and one of the feedback I'd received previously was they were struggling with again applying their pharmacology once they get to this course and to clinical practice. So this was really more about creating drug cards, the medications in the scenario. Why are they on those medications? So this was really more of a really focusing on the drugs used in the scenario. And one thing I forgot to mention, because this was a pilot, this was done at few sessions during the semester, so about 4 times in the semester. And they had to watch a pre-recorded video before they attended the session. And they also had a pre-seminar questionnaire as well before they attended the session. So they had things that they had to do before some of the sessions. So this is just sharing what the activities looked like. So I do have a QR code at the hand for anyone interested in really looking more into those questions. But just to highlight the AI group, so with the AI group, they have the first two questions, but once they sort of got into those first two questions, they had to think about potential complications based on what they're learning in the semester, and they had to create physical examination finding and diagnostic findings for their patients. And using that updated profile, they also had to create a care plan for their patients. And then the group that had complications, they had a lot of more guided questions with respect to their patient getting worse and how they're going to take care of that patient's getting worse. Right. So they also had a what if question in every seminar, like what if this happened? How does this change your care plan? So they had those guided questions. And at the end of it, they had to present to the class. So this was about a 45 minutes to an hour activity in class. And so they had to present their findings to the whole class as well at the end. Again, this helped them to share their resources together as well. And I did notice that there was a lot of similarities between the AI group and the I'll call them the traditional resources group with respect to the physical examination finding, their test, and their care plan. So there's a lot of similarities that I noticed at the end. So what we saw at the end of this, there was higher engagement and participation throughout the semester, and this was not just for the case-based learning seminars. Throughout the semester, students were asking more and more questions. They were asking deeper analytical questions. In the beginning, it was a little bit hard for them because they were focusing a lot on the social contextual factors in the scenario, which was good. But as they continue to progress, they start to prioritize, okay, how do I prioritize my findings and what do I need to do first for my patients? And I also teach the students for the full year. So in the second semester, they join a bigger cohort, so about 120 students. And I noticed again this cohort that engaged in the CBL compared to previous cohorts, they were more interested in what they were learning, and they were actually able to link the concepts from the fall to the winter, and they were a little bit ahead. I almost had to dial back a little bit to make sure all my students were getting, how do I explain it? Like they were being challenged, but at the same time, I didn't want to make it challenging for the students in the next semester. So they were really ahead. There was a sense of ownership. So all the things they created was in the class folder. They used it to study. They generated NCLEX questions using AI. So they were all using that to study. So they felt that they created it together. They created their draw cards together, which they shared amongst themselves, and they continue to use this even in their next year of nursing. So they felt really that they were involved in the process. Also, of course, saw improved performance. So they do have case studies in the class that is a take-home case, that their take-home case studies that also assesses their clinical judgment skills. And again, did notice that the students performed better on those in those case studies. And again, we're just comparing this from a previous cohort, and every student is different, so it's always hard to say. This is just what I'd seen in my assessment. And more importantly, they felt like part of a group. They had connections with those senior facilitators. They had their contact information because they were all going through this 2-year program together. So there was a form of like informal mentorship happening, and they felt that they could, if they had issues, they could contact the students in a senior year as well. So there was a lot of social outcomes that happened as well with this project. So just going to wrap up. Of course, it's important for us to assess the process of reasoning. So not just the final outcome. So while we're always thinking about, okay, what's the grade, but it's very important to see how are they reasoning to this, because this was a pilot, of course, was very formative, but for people that are interested in grading, there are ways to work on this to make it gradable. But also I would challenge you, like our first speaker talked about, with respect, not our second speaker, about on grading. This can be a useful tool if you're trying to incorporate on grading into your class. Of course, AI can be a creative partner as well, so we can use it to support rather than replace thinking. So encouraging students in the ethical use of AI as a study partner rather than something that just spews out the information to them because they had to interact with it a few times. And then finally, it's important to have that peer facilitation. I can see this can be a problem in larger classroom, but being able to have people, their peer facilitate, really help to boost your confidence when it came to presenting what they were learning in the classroom. So thank you so much. So that concludes that presentation. You can scan the code for the example of one of the seminars with the full objectives, as well as how it looked like, as well as the references.
Thank you, Sarah, so much. I think you deserve a lot of congratulations for your energy and commitment to change, and to trying new things and to making it better. That it's always easier to just keep doing what people are doing without, attempting something new. And so it's inspiring to listen to what you've done. And thank you for your willingness to share, your